standards for reducing carbon emissions. I covered her dedicating a rain garden in the Upper Ninth Ward in a rare sleet storm in 2014, and again in February 2016 at Xavier University when she was urging public health science students at that historic black college to join the Environmental Protection Agency. And I'm Mark Schleifstein. I'm environment reporter for, I have to say this slowly so I get it right, the Times-Picayune, the New Orleans Advocate, the new combined name publication that is what's left in New Orleans after what used to be the Times-Picayune closed in July. Gina, I swear we did not arrange this week's near record temperatures just for you, but they will certainly—
I was hoping you didn't plan the rains and sleet we had last time.
No, well, it would—
Good weather follows me wherever I go.
But they're certainly going to help set the stage for our discussion today. So thank you for coming. And let me just hit it and just start out. In your role at Harvard, you've been focusing on health impacts from climate change. Can you provide us with a couple of examples of where you see climate change having its worst effects on public health?
Sure. And first of all, thank you, Mark, and your coverage on many of these issues has been really important. So thanks for your voice, and I'm glad it continues to be heard. And secondly, thanks everybody for being here and actually thinking that maybe we can talk about climate change in a way that people will want to read and editors will want to publish. I like that. That's what we're here to talk about. I think it's important, and now that I'm no longer on the hot seat in the administration, I like journalists again. So this is all really good. No, I never didn't like you, but you were annoying sometimes. I'll just say that. But let me first explain, Mark, if I can, why I'm at that center at Harvard and why I'm, instead of being at the Harvard Kennedy School where all my colleagues end up, and which I spent some time there, I decided to go to the School of Public Health. And the reason I did that is because I've worked in so-called environmental agencies for 35 years, starting at the local level and then state level, and then finally during President Obama's administration at EPA. And in each and every job that I've had, it has really been fundamentally about public health. Yes, we care about land. Yes, birds and bunnies are important and ecosystems matter. But in the end, especially at EPA, our goal was to protect drinking water, to protect, basically the land so that it's safe for you to grow food and eat the food that comes from there, and safe for our kids to play. It was about swimming areas that are clean. It was about air that you could breathe and feel comfortable that your health was being protected. And so fundamentally, public health has been what we're about. And it frustrated me when I was the administrator at EPA because people dismiss the environment as something other than that. Like it was a luxury that you could afford to do if you can prove to me that jobs grow out of it, or prove to me that it's cost effective, but don't look at all those health benefits. And so the challenge that I think I have with climate change is that I just believe climate change is both the most significant public health challenge of our time, but it's also an incredible opportunity to invest in fundamental public health protections. So I think it's both a significant challenge and an opportunity if we think about it that way. So that's sort of my shtick. And many of the folks at EPA, when I was the administrator, sort of pushed back on that public health framing as if it wasn't enough, when I thought saying environment wasn't enough. It looked trendy. It looked like something you could easily dismiss. So fundamentally, I'm here to pitch to you and others that public health matters. In 35 years of asking people to accept government intervention in areas, it's all been about public health protections. People get engaged in it, people worry about it if it matters to them and their families, and if your coverage doesn't express that, then I think we're missing huge opportunities to get people engaged, to broaden that engagement, get more people involved, to look more deeply at ways in which we can do things that lead to a more just and sustainable future, but in a way that crosses a check mark next to public health benefits. Then people will care about it. So the big things that I push are obviously air pollution. You know, carbon pollution is a pollutant, just like what we used to see spewing out in the 60s. It exists. The challenge with climate is you can't see it, so people can argue about whether it's real and whether the problems are real. There's less argument about that now with your coverage and others, and with the challenges we're seeing today, but it's still incredibly important that we move away from questioning whether climate change is real and move into what are the real things it's doing to people today and how do we fix it. Air pollution is one of the biggest challenges we face. It also provides us a huge opportunity as you're reducing greenhouse gases to use strategies to actually address the air pollution challenges that are impacting those most vulnerable. And when you look at health, the most vulnerable are young people, old people, people of color, low income. That's who gets whacked in climate emergencies and exacerbated weather events and fires. Go look at the data as to who's being most hurt. Go look at who recovers most quickly, and look at what we can do to take advantage of what we know about the health benefits of reducing air pollution to direct things like transportation fixes and solutions where they're going to benefit those communities with the highest levels of air pollution. That's a good one. Heat stress is another. The reason why I think heat stress is important is because we don't sort of recognize that more people die of heat stress than die in all of the big weather events that we look at. And it's something we can fix. And the way you can fix it is to actually make people take care of one another again. You know, there's a great program in New York City that's being initiated that actually was designed by a graduate of the School of Public Health at Harvard. And basically her idea is, why don't we adopt a senior? So find an elderly person in your neighborhood, check on them when the weather gets difficult, put selective like cooling areas where people can go, so people can once again see this threat as solvable, to see that you can do this, and what you do is actually build a sense of community again, which I think the country desperately needs, is that localized sense of community. So if you focus on health, I think you motivate people, you make climate real, you get it into the part of everyday living and discussion, you kind of cut through the partisan politics that are dividing us, and and make science more meaningful and relevant to people's lives. So that's my hope. Long answer, short question. I like that.
So I understand you've been focusing especially on the healthcare industry and healthcare funders. Can you explain what roles they should be playing now in the future?
Yeah, Mark, I think one of the challenges we face is a big distinction between the focus on public health and the focus on health care. And we need to get the medical profession to understand that climate change is changing things, not just in terms of the ability for people to get care when emergencies arise. For example, lots of hospitals are in flood zones. Lots of hospitals have all of their HVAC equipment at the lower levels that get flooded out. You have to evacuate the hospitals. We've seen what happens in nursing care facilities. And I think we need to take seriously the challenge of looking at how to deliver health care in response to some of the weather events that are happening and learn from that. And but it goes well beyond that. You know, one of the things that the medical profession hasn't sort of gotten its arms around, that it's not just about weather events, but it really is about clinical care. What do we need to do to think about how medical professionals adjust how they care for people in a way that recognizes the climate is changing? Very, very quick example is that, there are many medications that physicians prescribe, many for elderly patients, that actually prohibit their body from sweating. Diuretics are a very good example. And the challenge that we face is when the weather gets hotter, it puts them even at more elevated risk. So why aren't we thinking about that as we're looking at a changing climate? Because obviously risks will exacerbate in a changing climate. And a lot of risks happen to kids that we don't really understand or haven't fully looked at, that climate will exacerbate. And so the real key issue is not to make it be about the buildings only, but clearly about that, but also just make it about the central core mission of why doctors become doctors and nurses become nurses, and how a changing climate might get them to think differently about care and how they deliver it, and get their voices out. One of the frustrating things that I have, that certainly we can talk about, is there are many areas where climate is a central part of the discussion. It's not a debate, it's just talked about, not as much as I would like, but the physicians, if they get engaged, we're working with the American Association of Pediatrics in particular, because climate is a big danger for kids. If we can get them engaged and we can get them talking out in the community, we can give a trusted advisor that people will listen to, that will hopefully break through some of the undercurrent that surrounds climate. And we need to get it into conversations. We need people that people trust to talk about it, not just the Pope, which is great. I love the Pope. It's wonderful that he talks about it, but you need to get people see every day and ask advice on health and get them to start talking about health and climate. That's the goal that we have, is to build it into the medical profession, get training around it, get it as part of the education for physicians, get them active, get nurses out there, because nurses are frankly a whole lot more trusted than doctors are, but don't tell doctors that.
So during the past few years, there's been a renewed focus on the state of the public's trust in both the media and government institutions. Yeah. Any ideas about how either of those can be bolstered?
I think the most important thing we can do, and let me talk to government as opposed to begin with journalists, because you can answer those questions better than I, Mark, is, we have to be honest with people, but part of the challenge we face, even when I was at EPA, is much of the time, because a lot of the decisions are based on science, or should be, or are supposed to be, and the law, we don't really explain things very well. One of the reasons why I'm at Harvard is that, climate science is complicated, but in the end, you can talk about it in much more realistic and easily understood and relevant issues if you don't start talking like a scientist. Because we talked about this a little bit yesterday, is that science, people don't know how science is done. Science is you put out a hypothesis and you decide, whether it's real or not by looking at what's happening in the world and what's likely to happen and see how close you got to predicting it correct, right? That's sort of how it works. Only nobody knows that. So when you start talking like you're in terms of confidence levels and certainty, people just read that as if you don't know what the hell you're talking about, right? So when you say it's very, very likely that anthropogenic emissions are causing, climate change, what in God's name does that mean to normal human beings? You and I would simply say, if it's really likely, then actually that means it's happening. To the best of our knowledge, this is what's happening. And anthropogenic means man-made. So basically it says we're messing up the climate, the evidence is clear, and we have to do something about it. It's an entirely different way of talking about it. And I think journalists, in your attempt to be clear, and scientists in their attempt to be clear, fails to make the case in a way that a scientist would say is absolutely correct. We just say it wrong, and we don't relate it to human beings' lives. You know, I have seen, one of the things that's sort of a pet peeve is to stop talking about climate change with the backdrop of polar bears and falling glaciers. Now, that may be relevant to climate scientists, but you're not going to catch a lot of people looking at that other than saying, ooh, that's pretty cool. They're cute. Well, polar bears aren't cute if you're close up. And they're lovely little things if they're where they belong and leave us alone. I'm not suggesting we don't want them to protect it, but for crying out loud, put a face of a kid struggling with asthma because air pollution is horrible, and we can't seem to get rid of the coal facilities that are so yesterday that aren't even competitive anymore because someone's dreaming that coal is the future instead of something that's been going away for decades. Let's cut it out. Speak clearly. Yes, we can talk about how to help the coal miners, but don't pretend it's about glaciers and polar bears when it's really about us and our families. Once people get that, once they absorb it, they'll be able to start really thinking maybe they can do something about it instead of hiding from it. That's the goal.
Any other tips for journalists on how to cover climate change effects in their own communities?
You know, I think I was just reading about one of the sessions on storytelling. You know, we know how people learn now. They learn from telling a story rather than, you know, talking about the underlying theory, right? And so I would just ask you to localize these issues. Find out what people are concerned about in your community, and instead of talking about the hopelessness of the situation or how hard it is to deal with it internationally, which of course it is, and that's fine to be covered, but if you want a local story, talk about what they care about and talk about solutions. You know, I never bring up a problem without talking about a solution, because the one way to turn people off and to get them to stick their head in the sand is to tell them that it's too big to fix or that they have nothing they can do in their own community to fix it. I don't think that's the case. I think the way that the environmental world has operated since day one has been to be as obnoxious as humanly possible at the community level so that change can happen, prove that good things can happen, then states have to start acting because they know there's a groundswell of support, and then when states start to act, then regions may kick in, and then eventually the federal government grudgingly does something about it because they don't want a patchwork of state actions, and then they claim it's really innovative to do what that first community was doing 20 years before. Well, I don't have 20 years to wait anymore. So if you talk about what people can do, how they can get empowered, how they can demand up instead of thinking the federal government is going to unilaterally solve this problem, that's the best thing you can do. So put a face on it. Find local community groups that are doing things. Talk about why it's not a really good thing to do for lots of other reasons than because we're going to save the planet. Because frankly, the planet doesn't give a damn if people live in it. I would assume they hate us if there is some consciousness of the planet itself, because we're pretty annoying. We keep changing everything. Let's just talk about people.
Okay. So there have been dramatic efforts by the Trump administration's EPA to roll back a lot of the regulations updated during your administration and before.
I know, isn't it fun? Isn't it exciting?
That's one word for it.
Yeah.
Obviously, the Clean Power Plan rollback ranks pretty much at the top of that list. Yeah. First, do you think the Trump changes will survive court challenges? And if they do, how difficult will it be for the next administration to reverse course and get back on the right track?
Well, two very different questions. First of all, one of the reasons to celebrate Scott Pruitt is his absolutely horrendous record of success. So I thought he was great. In all honesty, it was an extremely difficult transition for EPA. You know, one of the things I told folks was to, you know, keep your butts in the seat, You'll work through this like you've worked through every other transition, but this isn't like any other transition. These are not policy discussions. These are discussions really, and Scott Pruitt epitomized it, on how you can ignore science, try to change the science that the agency is allowed to look at, try to get people so uncomfortable that they're going to leave so they can dismantle it, cut the budget so that the agency will become increasingly ineffective. And it was all about getting rid of absolutely everything the Obama administration ever contemplated in its 8 years of history. And so it's totally unlike anything that we've ever seen before in terms of the threat it poses to the agency and to its mission. There is absolutely nothing they did that was consistent with science, the law, and the mission of the agency. And they couldn't even articulate it that way. All they articulated were benefits to industry. If you read it, that's all they talked about. And so the challenge we had even coming into it, and it remains a challenge under Administrator Wheeler, is that they went under Scott Pruitt and made a lot of changes quickly. What they failed to do was to read the law on how you have to do that. So their percentage in winning in court, which of course they're going to get sued, everybody gets sued for everything they do, and myself included. I once went to get a mortgage for a new house, and I thought that the bank was going to have a heart attack when they looked up my name and saw the hundreds of lawsuits that I was engaged in. I was like, no, not personal, not personal. But you get sued for everything. But they ended up, now they have something in the order of an 8% success rate of what they have done so far at EPA when you go to court. And it's because they don't understand how hard the process is. They don't understand that we didn't give easy wins in terms of rollbacks. We really desperately tried to do the kind of work that democracy requires, which is following the law, following the science, getting huge amounts of input. We got 8.6, I think that's right, 8.6 million comments on the Clean Power Plan if you looked at the comments on proposal and final. That is not because people hated it so much as we demanded engagement. We did hundreds of public meetings about this. If 3 people or more were gathered to talk about energy, there was a flip-flopper in the middle representing the environmental constituents and EPA. A flip-flop, I mean flip-flops because we wear those all the time at work. At least people think we do. Was there to talk about it and engage in it. And the reason why the Clean Power Plan is so difficult to roll back is that we did the job we were supposed to do. And we actually are seeing that it is now following the way that the clean power and clean energy is happening in the US, and it's not burdening people. In fact, it required a slower pace of change than the world is delivering for us now. And so we know that the future is there, which gets me to the second part of your question is, what's the next administrator going to do? You know, well, I'm reading today that they're repealing the what they like to call the waters of the US, which I call the Clean Water Rule. And they're repealing it instead of doing what their proposal said is repeal and replace, because they can't figure out how to replace. And what this is doing is basically cutting the legs out of the states who are already, you know, basically operating under the aegis of the Clean Water Rule and implementing it. And they want to make sure that nobody does that. So they're quickly sending out a repeal, and then they're going to think about how to take care of it, because they go into rulemaking with an end result, not looking at the science and the law in the mission of the agency. So I think the next administrator will have to give a lot of thought first to making sure that the internal processes of the agencies are functioning again. Make sure that science can be science. Make sure that scientists are in the right places where they can properly advise. Continue to beef up our ability to get out in the real world and say we're back on track. We care about public health and environmental protection. That's our mission. We'll follow the law. And I don't think it's going to be just as easy as returning the rolled back rules. First of all, I don't know how many rules are actually going to be completely rolled back given court challenges. But secondly, if the Clean Power Plan is already falling behind the pace of change in the United States, then we need to do more.
Could you rank other regulatory changes implemented or proposed by Trump's EPA in terms of their importance? Any others that come to mind that are significant?
Yeah, a lot. There are actually quite a few, and some of them go under the radar screen, have gone under the radar screen. I think the mercury and air toxic standard is a pretty big deal. That's another one where the industry has written to Administrator Wheeler before he even took office to say don't touch it because we've already done it and it's really good, and mercury levels in the air is going down, which means that you've reduced a neurotoxin that impacts fetuses and little kids mostly, and is making our fish healthier to be able to eat, which is all sort of good stuff, and it's already done, and they're still rolling it back for the simple reason that everything that we did has to be rolled back regardless of whether the industry that we regulated wanted it. The same could be said of the clean car rules, which I think are really important because all of these rules, especially the clean car rule, sends a signal to industry about long-term, where do they need to go, how do they head. We did 2 rounds of clean car rules because the industry told us that we need about 11 years to plan model changes. So let's go ahead and agree to do rules out to 2025. And we said, sure, we can do that, 2025, 26, 27. And we did that in 2 tranches, and the industry stood up with us. And now the administration's trying to roll those back in a way that makes it impossible for the industry to figure out what the future demand ought to be and how to meet it in the United States. That's the big issue that I don't think people really understand is what you do with regulation, if you're smart, is you try to figure out what the health hazard is that you're required to regulate, what the law says. But the trick is that you always need to be directionally correct, but you don't need to go further than you need to go for that direction to be firmly established. So it gets captured in the market, and the market then drives it the next level. That's how a smart regulator regulates, right? You're not fighting against jobs being eliminated as much as how do we get more jobs while we meet the mission. And I think the challenge that this administration has is that they've created a level of uncertainty and they're missing the boat in terms of putting a stake in the ground about where the United States thinks the world needs it to head for us to remain the economic strength that we've always been. I think this administration and how it's managing its international efforts as well as its domestic signals on climate are simply handing the economic strength to China over time because they are going to be kicking our butts on energy because they know that will be the leader if you can grab those jobs and those technology improvements. And one of the biggest things that's not happening in the US today is grabbing that leadership and investing in innovation so that industry and markets can then prevail and the US can maintain its leadership. And that's one of the biggest challenges. Can I mention one more rule? Well, I don't need to. You can continue. But no, I'm going to do that anyways. There's a couple of things that aren't rules that may be rules at some point, and these are going to be kind of confusing, and that's probably why nobody writes about them. But EPA has moved forward by policy, which is a written letter from the assistant administrator, or whatever the title is. I'm really bad at titles. To all of the regions and all of industry saying that you don't have to follow some of the rules when you actually invest in your facilities and significantly change them. Instead, you can upgrade them for efficiency, which sounds really cool, but when you upgrade for efficiency, you also can tend to increase the total pollution that you emit because you become more competitive in the marketplace so that overall air pollution goes up. And that's why there's these complicated, yes, they're complicated, ways in which the industry needs to ask about things like that. So you make sure that they have modern equipment in place so that while they may get more competitive and more efficient, the overall pollution is managed so that pollution in areas don't get degraded. By fiat, this one letter said, oh, never mind those, even though they have been on the books policies and processes for ages. That is going to open up huge opportunities, especially if you marry it with the way in which this administration is now looking at the mercury and air toxic standards and the Clean Power Plan. Because it's begging for change at the facilities, at the coal facilities themselves, to address things instead of looking more systemically at the energy system addressing them. So they're really setting up an opportunity for significant local increases in air pollution, both there and in the toxics world, because they said the same thing about toxics. They're rolling back something called the once in, always in policy, which basically says if you're a major source of toxic emissions, you have to install really good equipment. But if that equipment brings you down to emission levels that are smaller than major sources, you still have to run the equipment. Of course. Who would say get to those levels and then never mind, right? But they're actually saying that once you get to lower levels than that standard to determine a major source, you don't have to worry about it anymore. You can start turning off the equipment, as if industry unilaterally will decide, well, I'm going to be a good guy and I'm going to continue with that equipment, which is costing me money when I could just turn the switch and turn it off. It is an outrage because we are talking about toxics that directly impact our health and well-being. And many, if not most of these facilities will be in areas where you have high poverty because they'll get away with it, and because these are all localized impact, where you have minority groups that have been struggling living on the fence line of these manufacturers and refineries and others. And it's an absolute outrage to tell people that this is no longer the rule of the road, when it's been there for decades, Republicans and Democrats alike. So that's a big deal if you have a community that is actually regulated as a major source of toxic emissions, because they can now take great liberties at polluting more that will have direct localized impact.
So can you address the changes that EPA has made in how it uses science in developing its rules and its science advisory boards?
Oh God, I could, but I feel like I'm such a whiner this morning. Can we get to something less whiny? I'm going to try. This is not an uplifting question. Part of, I think, the challenge that EPA faced in coming in was that we actually did a good job at following the science. The agency is supposed to follow the science. It has independent science advisory boards, which often, tell the agency what they think and what they think is the risk, what they think of solutions, and many of them are set up by federal statute. And so, when I was looking at, for example, changes in national ambient air quality standards like ozone and lead, it goes through a science advisory board that's independent, that has expertise in all relevant fields of science, and that has representatives of industry and environmental community and others. And they give me a recommendation, and they recommend things, and our scientists recommend decisions, and that's the process. So it gets to the administrator as a pretty well-baked science discussion, and then the administrator has to use the judgment on how to translate that into a regulatory requirement. And I'll tell you, whenever my science advisor would come in my office unexpectedly, I felt like pulling my hair out, because it meant that they found something that's going to be really annoying, right? That I'm gonna have to deal with because they've found a science fact that we didn't know, and now it's gonna throw a monkey wrench in what I was working on that day or the next day. So I get that science is challenging, but we paid attention to it. We dealt with it even if it was gonna be difficult politically to explain or do things. This administration has chosen to restructure their science advisory board. And they've basically decided that any scientist that ever had any support from EPA is no longer eligible to sit on that board, which is the vast majority of scientists in my world have in some way or another, whether they're a graduate student or whatever have been. But if you're an industry person who's a scientist, you're not even conflicted against providing science advice on something that you're directly involved in. It's pretty amazing. And they've basically said that certain kinds of science that's been developed are no longer fit for review. So they're restructuring the whole way the agency does science, and they're actually tried to reduce the budget of our Office of Research and Science, which has been consistently reduced for a long time, but they couldn't eliminate it sufficiently, so instead they're closing labs that are vital to health protections that states can't do on their own, and we're generally the place where it gets done, and they're shifting scientists around to areas where they have little to no expertise. So it is an absolute strategy to make sure that science can no longer be considered, or the right science can't, or you won't have the right expertise at the table to advise you.
So
all good news.
Absolutely. So is there anything the Trump administration has done right with the environment?
Now this is the toughest question yet. You know, I know I joked about Scott Pruitt, but Scott Pruitt was a real problem, a credibility problem. And Andrew Wheeler is a much more thoughtful person who actually knows how government works. To me, that makes it a little bit more difficult because it's not going to be so easy. In court, he kind of gets it. So I'll give him, credit for at least having a history of how to do this work, because Scott Pruitt really had no interaction in this world at all, and Andrew Wheeler has. And so for me, the fact that he actually talks to the staff and has people in, even if he doesn't embrace what they say, is a step up. It's more respectful for the agency, and I appreciate that. I think that's good. So I think shifting away from Scott Pruitt to Andrew Wheeler for the sake of the agency was a good thing, although I have trouble with the decisions they're making. But Andrew Wheeler has made a couple of small decisions that do actually seem respectful of the mission of the agency. So I'll give him credit for that.
Okay. So let's open it up to questions. There are two mics in the middle of the room. Please go to the mic and use them.
I should have mentioned climate science, because they've not been very good on climate science, right? I should have mentioned that specifically. Yes?
I was just curious to hear your take on this proposal from the Climate Leadership Council that, essentially, as far as my understanding of it goes, would allow for a kind of tax dividend on carbon, but then preempt national regulation. As someone who filled your role,
yeah.
What do you think make of that deal?
It is not a fair trade-off, is what I think. I don't think there's, I know economists are really in love with sort of these types of arrangements. And I don't disagree that there needs to be a price on carbon. Regulations do that too. It puts a price on things. I just think it's really naive for us to think that there are going to be sweeping ways to address this that are actually going to be sufficient to make the kind of changes we want. I don't think there's an economist in the world who will tell you that putting a price on carbon is actually going to be successful in addressing all of the areas in which greenhouse gases need to be reduced. And I would never give up the opportunity to regulate in those areas, and nor would I give up on an opportunity to use liability in courts as a way to address the challenge of the fossil fuel industry. Right now, I think the court challenges which try to impose liability on the fossil fuel companies for not being honest about the risks of climate change in their product are some of the ways in which the fossil fuel industry is actually coming to the table. And that takes away those as well. Clearly not a fair trade, and clearly too easy a solution. And if Republicans will only come to the table with those gifts, then I would not give any.
This side.
Yeah, you talked about working with physicians and things about how to deal with the impacts of climate change. I'm a former still do health reporting. I fear a little bit that if we focus on dealing with the repercussions of climate change, we're not talking about how to reverse it. And I don't want to bring my own personal biases to it, but if you talk about how to deal with it, you're almost making it sound like it's inevitable.
Yeah, I mean, there are some changes that are inevitable. I mean, one of the big problems in my area of the world is West Nile virus. It's running rampant, and physicians are still failing to see it. But let me make really clear why I think involvement of physicians is important, not simply from a clinical perspective, because I really have no business in telling physicians how to do this. And my co-director is a pediatrician at Children's Hospital. He's the one talking about the clinical repercussions. The reason why I want it is to broaden the demand for climate action. I want to do exactly what you're talking about. I don't want more climate change to be inevitable, but the only way to do that is to get people to embrace it and empowering people to speak up and demand it. And so I think physicians and nurses and other medical professionals provide an opportunity to be out in the public and talk about this more, so that people will get over the idea that it's not about them or they can't do anything about it, and really start demanding actions of decision makers at all levels. So I'm with you entirely on your assessment of what needs to be done. I just want those voices out there because physicians won't get questioned about whether they understand science. They live it. Physicians won't be seen as being co-opted by the Democrats to say something silly. Do you know what I mean? I think they raise the credibility bar by their own stature, and they may have an ability to get people engaged in a way they haven't before. That's the reason why I want it.
Back on this side.
Oh,
Yep.
hi.
Hi.
You talked a little bit about sort of local level solutions as being a place to focus,
Yep.
and you mentioned this initiative in New York. Can you think of other local level solutions that you'd call out, and why you think solutions are the sort of where we might, as journalists, focus our
Yeah,
energy?
I started out at the local level, and in Massachusetts, we had many communities that developed their own community action plan. And that action plan was things like planting trees, bike paths, working on solar, getting it to access to everybody in your community, not just the wealthy. Developing zoning that looked at sea level rise and where you'd want to put it or not, protecting wetlands as a buffer against impacts from higher tides and fiercer storms. There are so many things in the end that end up being locally needed and driven, that every one of those things actually improve people's lives. And that's what I want. I want everyone to feel empowered, not afraid. I want everyone to look at the solutions they can drive. I just went to a doctoral student's dissertation in defense, and one of the points she made was people wondered why trees in some urban areas don't work as well to mitigate heat island effect as others, and it's basically the size of the tree. And part of the size of the tree is because of the air pollution in each of those areas and what's impacting it, how close they are to highways. It's sort of a system which I think begins and ends at the local level. So there's been a ton of work. And in Massachusetts, that's what drove Massachusetts to make changes. And that's what drove Massachusetts in Connecticut, where I worked, to be the leader in the Regional Greenhouse Gas Initiative. That's why we started it, because energy efficiency mattered. It would keep demand down. It would allow us to get a cleaner supply of energy, and it would allow people to benefit in their pocketbooks by keeping the price down. Now we have the Transportation and Climate Initiative, which is the same states and more that are looking at transportation policies on how they can actually put a cap on fuels and basically invest the money associated with that cap on transportation strategies. And the cool thing that we're doing as a center is to look at what the health implications of those are. Because I think governors and mayors need to get kudos from their voters that live today and not just talk about the future. So if you can design these strategies in a way that get at the communities that are dealing with the impacts of air pollution first, that's where you put electric buses. That's where you get rid of diesel buses in schools. That's where you talk about bike paths and trees. That's where it ought to go. If you can do this, people will be empowered instead of afraid. And I don't feel at all strongly about any of these issues. Just kidding.
So I want to continue on the fear and empowerment theme.
Yes.
Fear. Last November, I was at a meeting in Silicon Valley that included Lawrence Livermore National Lab, Opus 12, Stanford National Resources Defense Council, and Shell. And the gist of it was a very scary 2-hour conversation about how bad things are in terms of climate degeneration. And privately, in the private dinner afterwards, they said, oh, it's worse than we tell the public. We believe humanity in certain areas of the country, certain areas of the world, have 20 years. Do you believe that?
You know, I believe that this is an existential challenge, and I do believe what the Joint Chiefs of Staff have been saying since, I think, the Reagan administration, about the changes that they're seeing and the instability that will create. It's instability in the US, and it's certainly international instability as certain areas turn to desert that now have thriving populations, as certain areas become inundated and underwater. Yes, there's going to be all kinds of shifts, and we're already seeing it. Why do you think there's so many people from Central America coming here? It's because they've been experiencing droughts which make them unable to feed their children. What would you do?
It's not just political.
No.
And that's how it's reported.
No, it's not at all. And getting to the bottom of that would be really helpful. Because what would you do if you were that mother who couldn't put food on their kid's plate? Would you sit there and just say, geez, I love where I live?
No.
They want to go home, but they want a home that's safe. It creates instability like what we see happening in Guatemala and Honduras. Why do you think there are so many gangs happening? In the absence of leadership and in the absence of stability, that's what happens. And over you see this. This is exactly what happened in Syria. Is it the whole story? No. Is it a central thing to worry about? Yes. So I'm not suggesting we downplay. I am suggesting, however, 2 things. One is that if you fail to talk about solutions and things that we can do, they may not be commensurate with the challenge, but they move us in the right direction. Then you fail to downplay the ability to innovate that has answers we have never contemplated. You know, if you tell me I have to run a marathon and I have to stand at the finish line until I figure out that I can make it to the end, you will have nobody running that race because there's no certainty. And the thing that I worry about the most is young people are getting engaged for lots of reasons. Most of all, they're ticked off because they're taught the science at a young age and they get it. But we want to make sure, I want to make sure that they're not engaged solely because they're afraid and they don't realize that change can happen quickly. Now, if I had my cell phone, I'd hold it up. You know, who'd have contemplated this 20 years ago? So stop limiting our ability of human beings to be able to address our own problems by always focusing on the end and not the next step. That's not how change ever happens. So that's what I would say. So you got to stay hopeful, you got to stay active, You got to keep moving, and you got to invest in innovation that's going to get us where we need to go. Because I'm not ready to say, just because I can't figure out the end, I'm not going to keep moving forward.
So the second part of
Yeah.
my question about the empowerment
Yeah.
is, what do you think about the idea of regenerative farming?
I think it is the absolute way we need to go. And one of the reasons to be at the School of Public Health is that, you know, they deal with nutrition, population science. They deal with these things as if they're separate issues when they're all as a whole in a system. That's what climate change makes you think about. Regenerative agriculture, for those that don't know it, is about keeping the soil healthy and in place. And there are ways in which we can do this. One of the frustrations I have is that folks running for office now on the Democratic side, the great news is they're talking about climate change. But to me, this calculation of how much money you're going to spend on it is ludicrous, because it doesn't look at the costs of inaction, and it doesn't really look at the costs of what we already spend. If you wrote a farm bill that actually wanted to invest in regenerative, the developing world needs to head, and I think they know it, but it's difficult, but it's all about us primarily. If you did that, I wouldn't worry so much about harmful algal blooms, and I wouldn't so much worry about pesticides in our drinking water. That would be a pleasant future for me.
Okay.
Yep, it is a local story, absolutely. Yes, I'm sorry.
Now, over on this side.
Hi, my name's Diana Kenny. I work at the Marine Biological Laboratory in Woods Hole. And I agree absolutely with many of your thoughts on how we need to change the messaging about climate change. I think people have turned it off because it's too bad and too big and too distant and too far, and they don't know what to do. I love the title of the newsletter that you put out. It's called The Climate Optimist. If anyone,
Yeah, look
you
it
should
up. It's really
subscribe to
cute.
it. It's really
cool.
good.
It has the
and-
face of the cutest little kid on it, too.
Exactly.
Yeah.
And it's solution-oriented.
Yeah.
And one solution I've been thinking about, and I don't know if this is practical or not, but I live on Cape Cod, and there's a group called Cape Light Compact.
Yes.
And you can call them up, and they will work with you to change your utility supply so that it's all renewables.
Yes.
And I don't know if that's a national thing or not, but it seems to me if we believe the IPCC report that we have 10 years to turn this around, then everyone has to be changing their supply to renewables.
Yep.
And how do we get that message out?
You know, I would like to, and I think there is an opportunity. In Massachusetts, it's easy to sign up for renewable energy. In other states, it's not quite so. But in most states, they have programs like this. In Connecticut, we used to tell anybody that if they went around and signed 100 people up for renewable energy, then you could have a solar panel put on your local school. That's a cool thing. You know what I mean? But one of the things I'd like to ask you to think about is, and I love Woods Hole, not just as a place, but your science is amazing, and you're always active in these issues. I would like to connect the dots between oceans and keeping them healthy and climate change, because one of the reasons why we need to think about something more than putting a price on carbon is that the price on carbon is always going to be higher than the price we put on it, because that's why plastics are contaminating our oceans. People don't get how pervasive fossil fuels are in all of the markets that we rely on, and we have to connect those dots instead of having people who care about plastics versus people who care about climate. We need a better way of connecting those dots to the pesticides that we don't like, to the air conditioning, chemicals we can no longer tolerate. It's all about synthetic chemicals that are pervasive in so many markets that we just need to rethink. I don't hate fossil fuel companies. I don't hate the people that work in them. But we have to recognize that we know more than what we did when we did the Industrial Revolution. Figure it out.
Mm-hmm. Yeah.
But thank you for all the work that you do.
You've touched on this a bit, but what are the biggest and most urgent issues at the intersection of climate change and agriculture, in particular big agriculture, that we should definitely be reporting on or that you don't see reported on enough?
Well, I've been writing a little bit about this. This is what's fun, is that I get to hang out with scientists who actually can put articles in the New England Journal of Medicine and stuff like that. I think that the biggest challenge we have for food and nutrition from a climate perspective is moving away from red meat to plant-based. And being a little bit concerned about fake red meat and whether or not that is nutritious, given that it's as heavily processed as any food you would ever want to eat, and there's no evidence that it has nutritional value. So when you look at the Impossible Burger and you look at the Beyond Burger, these are all lovely things, but I don't think they add value when you stick them in the middle of a bun and you put stuff on them. You know, there's no evidence of what the nutritional value actually is, and they're very heavily processed, which means they're high in salt content. So we need to think about red meat, we need to transition to more locally grown food, and we need to recognize that we have to reduce food waste, but really almost equally important is you've got to get healthy food to the populations that need it most in the United States. Food deserts are real. What do you expect people to eat if their only choice is the competition between Burger King on one side and McDonald's on another? You know, we have to start thinking more specifically about real nutrition. And plant-based food and moving in that direction is a proven method to shift away from red meat and still increase our nutrition. And so we need to figure this out.
Thank you.
Is that helpful?
Last question.
Okay. Hi.
Hi.
Another Massachusetts person here. I'm Janelle Nanos with the Boston Globe.
Excellent.
Hi there.
Hi.
And I am a retail reporter. I cover consumer culture, so I've been taking upon myself to try and figure out new ways to think about consumption habits and how climate change is impacted by those habits. Two-part question. One is what message would you send back to my newsroom and other newsrooms about widening the scope of environmental coverage beyond just the one environmental reporter and incorporate the conversation about climate change into all of our beats? And two, the second part is, what role do we as news organizations have to take in terms of accepting advertising or funding from those who are contributing to the climate crisis? I know the Globe has a relationship with Koch Industries where they're an advertiser. Should we be accepting that money? And you know, is it helping further our environmental coverage? And can we kind of make that rationalization, or should we just walk away from that type of deal?
That's a really good question. Both are really good questions. You know, the first is I think the trick to getting editors to actually embrace this type of reporting is to make it as relevant to your readers as you can. And so, you know, I love the New York Times, I love the Globe, but I almost cringe sometimes when I open it up to a climate story because it's never positive. So somehow we need to maybe the approach isn't direct, maybe the approach is to talk about the impacts of climate within a story on health. Mm-hmm. You know, I don't know. I mean, I know that we all struggle with this, but personalizing it, making it relevant to your leaders, making it not just bad news, but good, I think would be very helpful. But you're gonna have to figure out how to personalize it. Mm-hmm. And because I think that's what people read. In terms of taking money, you know, I sort of cringe when I go to MIT to do some meetings with colleagues that I've known for a long time, and right next door is the Koch building. Yes. I sort of cringe when I know that you know, there are many at Harvard that take similar types of support. And, you know, you're going to have to use your own judgment as to whether it actually, taking the money, influences you to change a story or to not do a story. Mm-hmm. You know, because in the end, it's about maintaining your independence. Mm-hmm. And so while I'm hugely picky, having been in government, I don't take that kind of money. Mm-hmm. But I certainly work with lots of people that do, and I still respect their judgment. I still feel like they have an ability to have an independent voice. It's when you can't that you really have to think about it. And in this day and age, like for the folks at Harvard School of Public Health, with NIH funding being cut off for much of what they do, with EPA funding being cut off from them, you don't leave much choice other than to go to private foundations for support. And I'm not, and I don't, and I think you just need to think long and hard about how to accept money and maintain your independence no matter where that money's coming from.
Thank you so much.
Well, I want to thank Gina very much for coming out and doing this with us. Very enlightening, to say the least, and I appreciate the opportunity.
Well, Mark, can I just end up with my three facts that you need
Absolutely.
to say about climate change? Everybody here, are we ready? Climate change is real. Man-made emissions have caused it, which is why women need to rule the world. I will leave you with that. Thanks, Mark.
Thank you.
Thanks, everybody.